Racism is a public health issue in America, according to a prominent researcher who spoke at several events in Tulsa this week. Dr. Camara Jones, who is president of the American Public Health Association, was scheduled to speak long before the Crutcher killing, but her address to Oklahoma's public health community got to the heart of the grief and anger felt by many Tulsa residents.
A crowd swelled in Tulsa this week on the historic ground of the nation's worst and deadliest race riot. It took place in 1921 right here in what used to be the heart of America's prestigious Black Wall Street. For some people, the remnants of what happened have continued to smolder in generations of families in the form of distrust between the races. The emotional embers have once again flamed following the shooting death of Terrence Crutcher, an unarmed black man with his hands up by a Tulsa police officer.
Find it very difficult as we look at that video to see how anybody could not want to stand with the Crutcher family for truth and justice. And so I understand the young people y'all here? Yeah. Hands up! Don't shoot! Don't shoot!
Since the shooting, community leaders, especially members of the black clergy, have been calling for peace, and so have the slain man's family, who are demanding justice and peace. Reverend Joe Crutcher is Terrence's father.
If you're here for any other reason than justice and healing and love, you're in the wrong place.
Dr. Tiffany Crutcher is Terrence Crutcher's twin sister.
And so we have to make a decision. We have to get mad and say that the chain breaks here, right here where Black Wall Street started, right. Something that we're known for. Right. But today, we're not going to be known for that. We're going to be known for the city that caused healing across this nation, right here in Tulsa, Oklahoma.
Healing people through the elimination of racism embedded in social structure is the mission of Dr. Camara Jones, who is an acclaimed researcher on racial disparities. She says race is not something people are born with.
It's something that they learn in a given place and time. I live in Atlanta, Georgia right now. I'm clearly black. When I'm in Brazil, in some parts of Brazil, I'm just as clearly white.
As national president for the American Public Health Association, she is launching a national campaign to end racism, which she defines this way.
Racism is a system of structuring opportunity and assigning value based on the social interpretation of how we look, which is what we call race. The problem in this country is not race, the problem is racism.
As a result of her research on health disparities, she asserts that racism, as a social condition, is a fundamental cause of poor health and illness.
So why is race a health factor in this country? It's because of racism. It's because not only how we distribute health care resources, but the conditions of people's lives, housing, education, job availability or not. What some people call environmental racism.
She says assigning value to a person's worth by the color of their skin has been an issue since the birth of this nation. But today, we are paying attention to it because America is seeing it.
We're seeing this devaluation of black life and especially of black male life and the fear of black male life manifesting itself all over this country for centuries, honestly, but with the cell phone cameras and the dash cams and the body cams, we are now witnessing, even on the police, the agents of the state, the killing of unarmed black men, just like Terrence Crutcher.
Dr. Jones says institutional racism is pervasive and perpetuated by decision makers at all societal levels.
Racism continues to be alive and well and continues to have very profound impacts on the health and well-being of the nation, not just through health care and doctors and nurses, not just through lack of insurance and the lack of Medicaid expansion in this state, in my state, Georgia, but through how we're not investing in the full excellent public education of all our kids, how we are disproportionately incarcerating so many black and brown men and women in our prison system.
While in Tulsa this week, she spoke at the Oklahoma Public Health Association's annual conference and to those who attended her presentation at the Tulsa Health Department. Dr. Reggie Ivey is the health department's chief operating officer.
How do we have discussions with law enforcement regarding this particular issue? And the issue that I'm speaking of is racism and how it impacts the health of the community.
Dr. Ivy, like so many in the community, is personally impacted by Terrence Crutcher's shooting death.
When Mr. and Mrs. Crutcher heard about their son's death, I happened to be in the room with them. We were at my church, which is about a block from this location, and we were preparing for a musical that was going to happen on Sunday.
Dr. Jones says there is a reason for the Black Lives Matter movement.
In this country, you have people saying Black Lives Matter, and other people are like, why are you saying Black Lives Matter? All lives matter. Well, right now in this country, we do not act. Our practice is not acting as if Black Lives Matter. That's why people are asserting that. It's a hope and a wish and an assertion toward getting all lives to matter.
Tulsa police officer Betty Shelby says she shot Crutcher because she feared for her life because of his behavior and actions. But many in the community ask people to imagine, instead of Crutcher, that it's a white man or woman in the helicopter video. Would the outcome have been the same?